Hello class, today we will be going over a dental office emergency in which the patient is experiencing a cerebrovascular accident, otherwise known as a stroke. My name is Kimberly and my student assistants are Aya and Renee. In this scenario, the patient states that they are not feeling themselves today but needed to come in because they will no longer have dental insurance tomorrow. The patient states that they are having trouble seeing clearly, feeling a little weakness, and slight dizziness. As the patient is welcomed into the room, he is not quite sure where to sit, though he has been to the clinic multiple times before. We begin to review the medical history, and the patient states that he hasn't been feeling very well, has been having difficulty seeing clearly, and is experiencing some dizziness and weakness. The patient states he has had no change in his medical history since his last visit, but as we continue the conversation, the patient's demeanor rapidly declines and we begin to see unilateral drooping of the face. This is a telltale sign of a person experiencing a stroke, so we will begin to administer a series of simple tests collectively called the stroke scales to determine if the patient may in fact be experiencing a cerebrovascular accident. The patient is asked to hold his arms out, palms out, eyes closed for 10 seconds. As the patient attempts this test, we see exceptional weakness of the left arm. The patient is then asked to repeat a simple sentence: "You can't teach an old dog new tricks." The patient's speech is slurred and he is having difficulty even getting the words out. Positive findings on all three of these tests indicate that the patient may be suffering from a cerebrovascular accident. We will place the patient in a semi-upright position, and I will have someone contact emergency medical services as well as bring the oxygen tank in the event that he becomes hypoxic. We will begin to monitor the patient's vitals, and at this time, they are within normal limits, which is normal for a person in the beginning stages of a stroke. Hypoglycemia can mimic the signs and symptoms of a stroke, so we will administer glucose to see if the patient's condition improves. After about 10 minutes, the patient's condition has remained the same, so we will continue to monitor the patient's vitals and stay with him until EMS arrives. A cerebrovascular accident is an abnormal condition of the brain characterized by occlusion or hemorrhage of a blood vessel, resulting in a lack of oxygen to the brain tissues that normally receive their blood supply from those damaged vessels. There are two types of cerebrovascular accidents and two categories within each type, and will be further discussed on the coming slides. The ischemic type of stroke occurs when there is some form of blockage or occlusion in a cerebral vessel causing an oxygen deficiency. This is the most common type of stroke experienced by patients and is accountable for 85% of all strokes. The ischemic stroke can be further categorized into either thrombotic or embolic. The thrombotic type is the result of a blockage of a cerebral vessel where the cause of the blockage is composed of platelets, fibrins, and cellular elements at the site of origin. The embolic type occurs when a foreign object, quantity of air, or gas originates somewhere in the body and then circulates to another area where it becomes lodged in a blood vessel. In the background picture, you can kind of see a blood vessel going to the brain. You can see the red blood cells and then kind of a clump of them all stuck together that is showing the blockage or occlusion of the blood vessel. This does not allow the red blood cells to continue, and so blood is not reaching the brain, and therefore oxygen is not reaching the brain either. There are many signs and symptoms of an ischemic stroke. The most common telltale sign is hemiparesis, which is partial paralysis or weakness that can affect the arms, legs, and facial muscles. This is the sign that most people know to associate with a stroke. It is that drooping of one side of the face, and is where if someone sees someone with that kind of symptom, they automatically think like, oh yeah, this person might be having a stroke. The patient may also experience ataxia, which is loss of coordination, deviation of the tongue. Their pupils may be unequal and dilated. They may experience vision changes. In the video, the patient stated he was having difficulty seeing clearly. They may experience drooling, vomiting, confusion, speech changes. Back to the video, the patient had very slurred speech and had difficulty even getting very simple words out. Patient may experience nausea, a sudden onset of a severe headache, dizziness, dysphagia, which is difficulty swallowing, but total loss of consciousness is uncommon for this type of stroke. I did just want to note that the signs and symptoms listed on the previous slide are relevant to both the thrombotic and embolic type of CVAs. The major difference between the two is that a thrombotic stroke has an onset that is difficult to determine, so the patient could have been experiencing that onset for a lengthy amount of time, whereas an embolic stroke has a very abrupt onset. It just comes on very quickly. So that is why it is very important to note if the patient has felt like they've been experiencing these symptoms for a while, or if it's just something that suddenly came on, as it can help the medical team determine what type of stroke they might be suffering from. The second type of stroke is a hemorrhagic stroke, and this occurs as a result of the rupture of a blood vessel in the brain. This type of stroke accounts for about 15% of all strokes and can be further categorized into either intracerebral or subarachnoid. The intracerebral type of stroke is the result of a rupture of a blood vessel within the brain tissue. The subarachnoid type is the result of a rupture of a blood vessel on the surface of the brain in the subarachnoid space. So the ischemic type of stroke is where the blood vessel was blocked, but the hemorrhagic type of stroke is where the blood vessel actually ruptures or breaks open. There are many similarities in the signs and symptoms of a hemorrhagic stroke and the ischemic stroke. There are some differences. The patient will almost always experience an abrupt and rapid onset with a hemorrhagic CVA. Elevation of blood pressure is another symptom that is common to the hemorrhagic CVA. They may have an altered level of consciousness that can even result in a coma or a total loss of consciousness. So that's something that is not similar to the ischemic stroke. The patient may have an ability to stand or walk. Their pupils may be unequal and dilated. They may experience pupillary malalignment, nausea, vomiting, and that sudden onset of a severe headache is twice as common in patients experiencing a hemorrhagic stroke versus the ischemic stroke. The major difference between the intracerebral and subarachnoid hemorrhagic strokes is that the subarachnoid stroke has an additional symptom of neck pain or stiffness, and that is something that is unique to that specific type of hemorrhagic stroke. When it comes to treating a stroke of any type of origin, whether it's ischemic or hemorrhagic, the primary goal is to minimize the cognitive and physical limitations associated with cerebral ischemia or hemorrhage. As hygienists and clinicians, the way we can help with that is by immediately recognizing signs and symptoms that something is going on with the patient, as well as being able to recognize that those signs and symptoms likely lead to the patient is suffering from a stroke. We can utilize the stroke scales, which is that series of simple tests that was administered in the video, where we observe the patient for weakness on one side of the face, so that unilateral drooping that we saw in the video. Again, the patient is asked to hold their arms out, palms up, and eyes closed for 10 seconds and observe if we see weakness in one arm. Lastly, the patient is asked to repeat a simple sentence such as, "The sky is blue in Cincinnati." In the video we used, "You can't teach an old dog new tricks." Just want to give them something that is not too difficult and easy words because we are observing if they're having difficulty or slurring in their speech. As I said before, the most important thing we can do as hygienists is be attentive to the patient and to be able to quickly recognize signs and symptoms that something is going on with the patient. Furthermore, to recognize the signs and symptoms that a patient may be experiencing a stroke. We will need to contact emergency medical services immediately because once a patient is experiencing a stroke, there is really nothing that we can do to help them. So the only thing that we can do is stay with the patient, make sure that we get them to emergency medical services as quickly as possible. If a patient is experiencing an ischemic type of cerebrovascular accident, if they are in the hands of a medical team within 3 hours of the onset, they can be given a thrombolytic agent called alteplase, which can help break up the blockage of the blood cells to help restore blood flow to the brain and in turn restoring oxygen flow to the brain. This is contraindicated for patients who are experiencing a hemorrhagic CVA because it can cause more bleeding into the brain and will cause the patient to deteriorate even more. That is why it is so important to get whatever information you can out of the patient, especially regarding the onset. Asking the patient if they have been feeling these symptoms for a while, how long, what time of day did they start feeling these symptoms, or did it just start happening right in the chair? Because this can help us help the medical team. We can tell them what we know, what we've gotten from the patient, so that they can determine what type of stroke they may be suffering from and already have a plan of action when they get to the hospital. In the meantime, while we are waiting for the medical services to get there, we want to position the patient in a semi-upright position, and we want to be checking on the patient's airway, breathing, and circulation, making sure that they are able to breathe. And oxygen administration is only indicated if the patient shows signs of having difficulty breathing or is becoming hypoxic. We want to check the glucose level to rule out hypoglycemia. As stated in the video, the hypoglycemia can mimic signs and symptoms of a stroke. So if we give them glucose and their condition improves, then maybe they are not experiencing a stroke, which is good for the patient, but of course we still want them checked out by the medical team. After that, the main thing that we can do is continue to monitor the vital signs of the patient until the emergency services arrive. As I said before, one of the signs and symptoms of a hemorrhagic CVA is elevated blood pressure. So even if the patient wasn't exactly sure when they started feeling these signs and symptoms come on, that elevation of blood pressure can indicate that they may be suffering from a hemorrhagic CVA. So it is very important that, like I said, we are able to recognize those signs and symptoms, and really we just want to get them to an emergency department as soon as possible to give them the best possible outcome, and hopefully they don't suffer all the traumatic after effects that can come from having a stroke. Some things that we can do to prevent the medical emergency of a patient experiencing a stroke in the dental office is to ensure that we complete a thorough medical history review with each and every patient. There are conditions that put patients at higher risk of having a stroke, and these can include hypertension or high blood pressure, high cholesterol, patients that smoke, if they have diabetes, and obesity. So just kind of going through their medical history and noting any kind of conditions they may have can put our brains on the radar, like, hey, this patient may be at a higher risk of experiencing a medical emergency in general. If the patient has had a stroke within 6 months, we want to postpone all elective care. And if they have a history of a stroke, we want to try to keep the appointments short and as stress-free as possible. And it is better to have these appointments scheduled in the morning for these patients. We also would want to use the cardiac dose of a vasoconstrictor. As we know, vasoconstrictors constrict the blood vessels. So if the patient already has had a stroke and we know that they've had a blockage before, then we don't want to constrict those blood vessels too much and essentially maybe put the patient into a situation where they may experience a stroke in the chair or later on after we send them home. Another thing that we can do to help prevent stroke or medical emergency in general in the office is to make sure that we take vitals of each patient when they come into the room. This can give us a baseline as to where the patient is at before we start treatment. And like I said, hypertension and other conditions can lead to stroke. So if the patient has an elevated blood pressure when we take these initial vitals and they have no history of hypertension or they're not taking any kind of medications, they could have an undiagnosed hypertension situation and it could be very poorly controlled or not controlled at all. So we want to be very cautious using local anesthetic agents with a vasoconstrictor. If possible, we would probably want to not use a vasoconstrictor at all. And if the blood pressure is too high, of course, we want to postpone treatment and refer them to a primary care physician so that they can be evaluated and we can make sure that we keep the patient safe in our office. If they do have an elevated blood pressure when we are taking these vitals and they have a history of hypertension, we want to make sure that we ask the patient if they took their medication today. For some reason, a lot of patients think that they shouldn't take their medications when they come into the dental office, but that is not true. If there were a situation, there are specific situations, especially when it comes to like blood thinners, where their physician may recommend them to stop their blood thinner for a certain amount of time, usually more associated with extractions, but of course we would always want to consult with their physician. So that is also another thing that we can do is if we see the patient has kind of an extensive medical history or if they've had a history of a previous stroke, is to just go ahead and consult with the physician and make sure that they also agree that it is safe for us to A, perform treatment at all, and B, if we need to use a type of local anesthetic agent that does not have a vasoconstrictor in it, such as mepivacaine. If anyone has any questions, please feel free to reach out and ask. I just added this little picture here at the end, and it is just a nice little acronym type thing of how to spot a stroke. I think it gives a nice visual, and it's an easy way that we can remember, other people can remember to know the warning signs and symptoms of the stroke. Be fast. Is the patient having a loss of balance? Do they have blurred vision? Is one side of their face drooping? Are they having weakness in their arm or leg? Are they having difficulty speaking? If they are exhibiting these symptoms, then we would want to call for an ambulance immediately. It is important, of course, to be able to recognize the signs and symptoms in a dental office, but knowing these signs and symptoms could also potentially save someone's life out in the real world, anywhere else, the mall, a restaurant, anything. So I hope that this has helped you guys, and thank you so much for listening.